Hey guys, we're in what hospital?
Warringal
Warringal Private Hospital
in Melbourne, Victoria.
Melbourne, and it's about it's nearly 8 o'clock. We left home at 5:30.
It was dark and cold.
And we had ice over the windscreen. And there's a bit of activity as you walk in hospitals. So today is the big extraction
Big
day.
Yep. Lose half of what I haven't got.
Don't know if it'd be half.
Well, there's not much there.
Anyway, today's surgery.
Yep.
We're here earlier because you've got to get a wire.
I've got to get the hook wire done and the dye for the sentinel nodes.
Mm-hmm.
So there's been changes to the time of the surgery. Initially I was booked in for about 1:30 this afternoon. Now the surgery's booked for about 10:30 in the morning, and all the other appointments have had to be moved forward as well. But I was apparently the only one that knew that, so I had to let the staff know.
As usual, she's the organiser.
So yeah, that's what we're up to right now.
So by about, when is it, about 11 you'll be in?
Surgery's booked for 10 a.m,
okay.
but I think probably 10:30. Depends on how the two procedures before me go.
And then the surgery could be two to three hours, depending on how things go. So
Yep.
fingers crossed everything's good.
Yep.
We have full faith in the surgeon. She seems very experienced.
Yep, she thinks it's an easy one.
Yeah, which is always nice to hear. And I'll be hanging around, probably do some editing for videos for my channel.
And this one.
Yeah, I'll probably have to edit this one, and there's a cafe just out there, so I'll be well caffeinated.
And I'll be looking forward to a chocolate donut later.
I'll buy up there all of their stock of chocolate donuts.
So I've been threatening chocolate donuts for years. So that's it for right now. We're going to get the hook wire done, the other thing done, the dye. So we'll check in throughout the day and see if you can get some sense out of me when I'm off my tree after surgery.
Yeah, so this video will encompass what happens today.
Yeah.
And we'll...
Providing I survive. If I don't, Chris will have to do a separate video.
Yes, well...
So this spoiler alert, I've survived.
Well, that's right, yes. Otherwise, if you don't, I won't film this,
Yeah.
Edit this.
Yeah, I still would.
Did we really need to go down that path?
You know me.
Okay,
Anyway,
so we'll catch you
We'll be back
shortly.
Wow.
Here we are after the event, and she's still with us.
So yeah, we had the surgery ended up going for nearly 4 hours. I'm in ICU at the moment, and we'll be here until probably tomorrow sometime.
So, from what we understand, everything went quite well.
Yeah.
We haven't seen the surgeon. You'll probably see her tomorrow.
I'll see somebody tomorrow. Yeah.
But they just wanted Christine in ICU. We knew this was going to happen just for more complete monitoring.
Because of what happened with the cortisol the other week, I'm now in the special needs basket.
She's special needs basket case.
So we had a pretty hectic morning this morning. We had to go and have the hook wire done, and there was lots of dramas with that. And apparently the tumour or the mass must have shrunk since the last ultrasound 6 weeks ago.
They couldn't actually find it with the ultrasound, which we think must be a good sign.
Yeah.
So you had to have a mammogram to insert the hook wire. Is that
We
right?
had to walk up a hill to another building outside the hospital.
And it was freezing cold in Melbourne today.
Yeah. And so, yeah, I had to have a hook wire inserted via mammogram. Look, there's no sugarcoating this. It was actually really painful. They gave me a few local anaesthetics, and then to get this really thin hook wire, and it kind of looks like an overlocking threading gadget.
Really fine wire.
Yeah, but it was quite long, and they had to put that into the side of my breast, and they had to keep on pulling or pushing. So that was quite uncomfortable and painful, even with the anaesthetic. But that was done, and then I had the other procedure done with the dye.
Yeah.
And I tell you, that was really painful.
Like bee sting pain.
Yeah, 4 injections right around the edge of the nipple. The needle going in is fine, but then when they put the venom that was excruciating pain. So
It wasn't actually venom, but yeah.
no.
We'll have to keep this fairly short because we haven't got a selfie stick, we haven't got a microphone, and my arm's getting sore.
Okay, so yeah, I'm feeling pretty good, bit spaced out, have had dinner, so yeah, I'm feeling okay.
Got
Are
through
you
it about.
feeling okay?
I'm feeling okay. It's been a long day. We left home. Oh, we said earlier, didn't we? We
5:30 this
left home at
morning,
5:30.
and it's 6:20 in the evening
Yeah.
now.
So Christian will probably do another update tomorrow,
I will, yeah.
and this video will come out in a few days. So I guess when we get
Hope so.
home.
If I learn how to edit a video on my phone, I might even get it up earlier.
Okay, that's it for now.
So cancer's tough.
Oh, we're not finishing up, but
Oh yeah, but I was going to say cancer's tough. No, I was going to say cancer's tough, but hopefully the bugger's gone now.
that's it. All right, back soon.
Yeah, that's. It's 2 days after surgery, and I'm going home tonight. Chris is going to pick me up about 6 o'clock this evening, and it's just after 1 o'clock in the afternoon. I'm feeling really good. I'm not in any pain, and any pain that I have had, I've just been managing with just normal Panadol, so everything's been pretty good there. I have some kind of a Pico 7 pack. This is to draw the excess fluid out from the wound that's healing, and everything seems to be going all right. Much better sleeping in the ward here. The first night I was in ICU, and they had these pressure bandages on my legs to keep the blood circulating. So between that and a bed that kept blowing up and down constantly, didn't get much sleep at all. But apparently I snored really well. So I'm in good spirits, feeling well. I will get this video up when I get home tonight, so there won't be any further update. I'll just get it up, and you'll know that I'm home and safe when you see this one released. I haven't had my laptop here, and I probably haven't even had the brain function to do anything as yet. I had a look at the wound because I didn't know how the surgery was going to be performed. So obviously I can't show you how it looks because I think YouTube would probably fire me. But if you imagine a circle, so you've got the circle of the breast with the nipple on the inside, and you just cut a line going straight across the circle. So straight across here there's an incision, then you've got the nipple, so that has all been cut out. They've done whatever they've needed to do, and they've restitched this seam here and around the edge of the nipple. I do remember just before I went under in surgery, I said to the surgeon that I was going to be inspecting her stitches, because I always do that. And I do inspect the stitches as well. I expect perfection. And she's done a really good job. So there's a very neat row of stitching across here. You can actually see it because it's a clear wrap over there, and some perfect stitches right around the edge of the nipple. It sounds really gross, and the idea of it is really gross, but everything seems to be intact there. Under the arm, I had one lymph node removed, and then there was a flap piece done to fill up my breast. So there's a wound underneath there that's getting repaired or drained out as well. I've also had my port removed, which was over on this side. So I've got a little bandage over there as well. And I will get the results of all the, what's left of the cancer in about a week and a half when I go back to the surgeon to have my dressings removed and to have this thing removed as well. So I don't know if we mentioned anything earlier. I was a bit spaced out at the time, but when we had the ultrasound to have the hook wire put in, they actually had a lot of trouble. They couldn't find where the side of the tumour was, and the little pea-sized thing that was in there, they struggled to find that as well. So we actually had to go out of the hospital, up the road to the place where they had the mammogram, and they did the hook wire via mammogram there. And the tumour must have shrunk so much in the last 6 weeks, which is sounding promising. Hopefully they've got all traces out of there, and then I won't have to have any more chemo, and I'll just have to deal with radiation when that comes up in a few weeks' time. So I am going to love you and leave you. I've got a book to finish, some pretty ordinary movies to watch, and some pretty ordinary dinner to eat tonight as well. I'll be glad to get home. So cancer's tough. I reckon we're a lot tougher, and I'll catch you next time. Bye for now. And before I go, I do just want to thank everybody for your well wishes on Facebook, in the comments as well here on YouTube. Absolutely fantastic. Chris put a post up the other day just to see how I was going to let you know how I was going. And I really appreciate all your comments and well wishes and all the love that you've sent. It's been absolutely amazing. Thank you.